So I've entitled today's presentation as Working with Low-Income Populations, Groups, and Individual Care, Culturally Humble Approaches to Working with a Vulnerable Population. So a little bit of background on communities living in poverty. So what do we know about this population? Well, we know that individuals living in poverty often experience poor social determinants of health. So things like unstable or unsafe housing and lack of access to adequate health care, which often in turn means higher risk for chronic diseases, food insecurity, substandard education, and then also higher rates of trauma. And that trauma piece, I think, really tells us a lot about the kind of social work care, mental health care we need to offer these clients. So in my literature review, the first thing that I came across was strength-based therapy, which we've talked about in lots of our social work classes. So we know that using strength-based therapy with this population in particular can help build resilience. Again, and resilience is so important in a population that has encountered so many barriers and has often encountered oppression. So this is a really appropriate strategy. And it keeps the client in the driver's seat. It promotes self-efficacy, the idea that they are capable, and it helps us as a social worker to avoid condescension or what's often called the righting reflex. And then also with the strength-based therapy, we're pulling attention to a client's capabilities and we're reminding them of their strengths, which usually gives people the feeling of empowerment and encouragement rather than focusing on their deficiencies, which can have a negative effect. So I think an even more appropriate and more encompassing approach and method for this population is something called trauma-informed care, which has 5 pillars or 5 principles. The first is to bear witness or to acknowledge the patient's experience of trauma. The next is safety and trustworthiness, so to provide a safe space for our clients where they feel listened to and not judged. And then choice, control, and elaboration. And this just means really including patients in the healing process. So making sure that they are a part of goal setting, and that they know that you're there to help guide them, but again, they are the experts of their own lives. The fourth pillar, it comes back to that strength-based and skill-building care and being genuine about that, right? So believing in the patient's strength and resilience. And then lastly, but an important one, is cultural, historical, and gender issues. So making sure that the processes that we're incorporating and we're using are sensitive to our client's unique identity. So how does this translate into the different components of our care? How does trauma-informed care and strength-based approach translate into our engagement with these clients? Well, number one, an effective way to engage our clients is building rapport, right? So building rapport early on. And the way this comes back to trauma-informed care and strength-based, again, is reminding the client, maybe even verbalizing to them that they are the expert on their own lives and that throughout their care with you, you will be moving forward with that awareness. And then again, providing that empathy in a non-judgmental atmosphere. Then also sometimes an effective way to engage with this population is to meet basic needs during your programming or your session with them that they often lack. So sometimes offering food or shelter or warmth, even if it's just for the hour or two you're with them, can go a long way in establishing a relationship and getting their trust. And then another way to effectively engage with this population is setting an example of inclusion and diversity with your staff, so with your team. When you have a diverse team, this sends a message to your population that you appreciate and celebrate diversity and differences. So assessment. One effective way, an appropriate way to assess this population is using motivational interviewing, which can also fall in the intervention category, but it is an effective way to find out what a client's areas of improvement are and figure out what kind of goals to set from a strength-based view, so without pointing out their deficiencies. And this can be especially effective in a population that is often faced oppression and has often been told by society, you have these deficiencies, you are not enough. And then another effective form of assessment is making sure that you use evidence-based tools that are relevant to this population. So this would be things like a food security scale, an adverse childhood event survey, which screens for trauma, the Edinburgh Depression Scale, Project SAFE, a housing instability survey. These are all appropriate for this population and they're based on evidence. And then again, coming back to being intentional about building rapport from that assessment piece, which can really allow you to dig deeper and get to the core of what's going on with these clients. So intervention, again, coming back to that motivational interviewing, which is a strength-based approach of counseling, and again, reinforces the client's autonomy and promotes that resilience. And then another effective way to intervene with our clients is making sure that we are aware of what the client's goals are, what they hope to accomplish, as opposed to what we believe they should accomplish. And it's interesting, research has shown that some social service resource allocations for specific communities often don't reflect the priorities of those communities. So that might mean that resources are being allocated for mental health services in a neighborhood whose priorities actually show that they would benefit from increased access to health care or increased access to grocery stores, food. So understanding the client's goals for themselves. And then again, as part of your intervention, having a diverse staff can help in your intervention piece or in your programming by having staff members, not just from multiple cultural backgrounds or racial backgrounds, but also different disciplines, can ensure that your curriculum or your processes or your programs are well-rounded and reflect the perspectives of lots of individuals. And then lastly, an effective intervention for a population that often has so many needs that often don't just fall into one bucket of health, clinical health care, mental health care, and food security, is having a network of appropriate referral services where you can refer your client when your program no longer meets the needs that they have. And then evaluation, making sure that you have consistent and appropriate documentation, that you're charting appropriately, and that the outcomes you've set out for yourself and your client or clients are specific and that they accurately assess whether or not the goals your client and you have set have been met. And I also really think that including client satisfaction as a measured outcome of success should always be a measured outcome when working, again, with a population who's often has not been given a voice. If their perceived success of your program, of your encounters with them, should be a measure of success with your encounters with them. So in conclusion, what I found is that when working with individuals living in low-income neighborhoods, whether in group programming or one-on-one therapy, utilizing trauma-informed care with a strength-based approach is key. In a population that has poor social determinants of health and a possible history of oppression, fostering good rapport, establishing respect and autonomy is a really effective way to support a client in reaching their goals.